Hello, I'm Dr. Mark Vaughn. You're watching this presentation because you're the caregiver of a patient currently having surgery. For just a few minutes, we'll cover the topics that you'll need to know in order to confidently care for the patient. It's important to remember that these are general instructions and that your doctor or nurse will provide specific instructions according to the patient's needs. This video presentation covers the post-op care for a patient who has just had surgery on either knee. If the patient that you're caring for is having a different procedure, please notify the receptionist at this time and request the proper video presentation. So let's get started. We're going to teach you simple instructions on how to transport the patient in and out of the car and into the house, the use of crutches, how to properly use the leg brace and ice machine, do exercises, track medications, and bathe the patient. We'll also be providing food recommendations, including what foods to avoid. We'll also teach you warning signs and what to do if you see them. Here's what you can expect in the coming hours and days when caring for the patient. Within the first 24 hours, it will be common for the patient to feel sleepy, weak, dizzy, nauseated, and have a sore throat. Because the first 24 hours are crucial, the patient should not drive, exercise, or do anything difficult like vacuuming or lawn mowing. They also should not drink alcohol or take sleeping pills, take aspirin or aspirin-like products such as Motrin, unless told to do so by the doctor. The first step, though, will be to safely transport the patient home. The nursing staff will assist you in getting the patient from the wheelchair into your vehicle. Transferring the patient from the wheelchair to the car can be done easily and safely with these steps. Position the patient behind the passenger door alongside the car. Ask them to help you if they can. Lock the brakes of the wheelchair. Carefully remove the legs from the footrests. Move the footrests away from the patient or remove them and set them aside. Lift the patient out of the chair. Place your legs apart with the patient's legs together in between yours and lift the patient up. Take small steps toward the car while slowly rotating the patient. Lower the patient into the seat butt first. With your right arm under the patient's legs, carefully pivot the patient so that the legs are inside the car. Secure the patient's seatbelt and ensure that arms and legs are inside before closing the door. To assist the patient getting out of the car, simply reverse the previous steps. Getting the patient from the car and into the house, the patient will need to use crutches. If the patient is unfamiliar with how to safely use crutches, please click the link below to watch the instructional video. The patient will come out of surgery with both the leg brace and the cold therapy knee pad intact, and both will remain on the leg for 2 weeks. Using the cold therapy ice machine is an important part of the recovery for the patient and will help by decreasing pain, stiffness, and swelling. Use the cold therapy ice machine frequently, every 20 minutes during waking hours. That's 20 minutes on and 20 minutes off only during waking hours. Follow these steps to use the cold therapy ice machine. Fill the ice chest to the top with ice, being careful not to overfill the ice chest. Next, fill the ice chest with cold water up to the line indicated. Put the lid on and bring the handle up to secure the lid. Press down on the metal tabs until they click, and then connect the hoses together, making sure they lock. Plug the power supply into the DC jack on the unit, and plug the other end into a wall socket. Once it has power, the unit will immediately start circulating water through the pad. It's important to take the pain medications as directed by the doctor. By using a chart like this, or one that's similar, it's easy to track when medications were given and when the next ones are scheduled to be given. This is important because improper use of medicines can result in the patient getting too much pain that's harder to knock down with more pain medicine. So stay on the schedule. For the first couple of weeks, physical activity of the knee and leg may be limited to ankle pumps. Ankle pumps are performed by moving your ankle up and down while in a seated position. The motion is similar to pumping the gas pedal in your car. Your doctor will have you start with doing 20 ankle pumps every hour. Because the patient is unable to get the knee wet for 2 weeks, they shouldn't bathe, shower, swim, or submerge themselves into a hot tub. Sponge baths are recommended during the 2 weeks. When the patient is ready to eat, begin with clear liquids like water, 7-Up, Jell-O, or apple juice. It's important for the patient to drink a lot of liquids. Stay away from milk and milk products, fried, fatty, or spicy foods. Add foods slowly. If the patient feels sick or vomits, have them stop drinking water for an hour or two, then start over again slowly with clear liquids. There are warning signs for you to watch for. If the patient experiences any of these signs, call the advice nurse at once using the phone numbers given to you by the doctor. If the patient continues to feel sick after the first day or starts to vomit and cannot stop, can't keep anything down or drink anything for 24 hours, experiences a bad cough, shortness of breath, or painful breathing, has a fever of 101 degrees Fahrenheit or higher, is unable to urinate, if pain is not relieved by the medication, if the dressing becomes wet and falls off or becomes blood-soaked before follow-up appointment, if the wound becomes red, warm, or there's hardness around the wound, if the patient's foot or toes become cold or blue, if the patient experiences swelling or pain in the calf or foot, or if numbness or tingling occurs in the leg. Again, don't hesitate to contact the advice nurse if any of these symptoms persist or if you have any questions or concerns regarding the care of the patient. It's important to remember that these are general instructions and that the doctor or nurse will be providing specific instructions according to the patient's case. Feel free to watch this presentation again while waiting for the patient. We recommend watching this again at home with the patient once they are up and alert. We believe that an informed caregiver is a confident caregiver. We hope that this has been helpful and informative so that you can confidently care for the patient.